Bladder cancer can present in many different fashions. It can be found as what's called microscopic hematuria, which is microscopic levels of blood in the urine. Gross hematuria, which is visible blood in the urine. Also burning, urgency, frequency. Sometimes people will feel as though they're infected because the blood is an irritant.
What first made me aware of the situation is, I'm at work and I go to the restroom, and when I was urinate, it would be a lot of blood in there, and it's kind of a frightening experience.
Generally, the actual diagnosis is made whether the presenting symptom was blood visible in the urine or not. The actual diagnosis is made through a camera inspection of the bladder.
My primary doctor referred me to Dr. Davidson. Dr. Davidson, in turn, went in and they call it a cystoscopy, where they actually go in and they look in your bladder and they could see, and it's put on a television screen, so I visually could see it as well. And at that point, he says, well, there it is, it's cancer. And I didn't hear too much after that.
At that time it was discovered they certainly had a papillary carcinoma, or bladder cancer, and he went to the operating room and it was resected. Fortunately for him, the parameters were very good, which suggests that we could handle this in a non-invasive manner without surgically removing his bladder. So we began a series of bladder treatments to treat the situation, and it's been able to maintain his bladder health without requiring more advanced surgery.
I have a scope every 3 months just to make sure, it didn't come back. Unfortunately, the first time it did. It was just in a few areas, so it wasn't nearly as bad as it was the first time, which was great for us. We could have treated it a little bit more or go back, and we decided to just get rid of it. The news was good. It didn't get through the muscle, so I was very lucky.